So my name is Fabian Wander. I'm the Director of Health and Wellness Services here at Ostos Community College. So did you have a question? Did you want to start asking me questions? Do you want me to talk a little bit about the South Bronx and
You can talk like the Latino presence in
Sure.
the Bronx. And
So I can tell you a little bit about the non-for-profits. I think the Bronx has the most non-for-profits out of all the 5 boroughs. I believe so. You can do some research to check. We have many different support services in the Bronx, and so the college itself has something called the Center for Nonprofits, which is one of the only ones, I believe, in the city that offers training for executive officers or CEOs or leadership at different non-for-profits, teaching them how to run their organization, giving them information about from leadership to what's happening in the community and how to kind of adjust their services accordingly. It's always comes out of our continuing ed program, and the director is Eileen Newman. That was someone also I thought would be helpful to connect with because she's very familiar with all the organizations in the Bronx, non-for-profit specifically. There's some areas that do those trainings, but it's very expensive. So we actually offer really affordable training for those people running those organizations. So as far as the Bronx, we have many not-for-profits, and some are small, some are huge, and they're based on the needs of the community. So obviously, specifically the South Bronx, I don't know if it still is, but was the poorest congressional district in the United States of America, and if it still is, obviously there's a lot of need, right? From obviously finances is a big challenge. So we have a lot of folks that live in the community that fall well below the poverty line. With that comes a lot of concern and issues, and that spreads across the area, across the board. So we're talking about health issues. There's a strong correlation between level of socioeconomic status and your health outcomes. So basically, the lower you are in the socioeconomic scale, the more likely to develop health issues or have poor health outcomes. So with that, we're looking at a lot of health organizations trying to address health issues in the Bronx. We have city agencies that run. We have non-for-profit smaller organizations, and so they might promote health. They might take a preventative approach towards health. You have mental health services that are again available, and there is that correlation again. If you're struggling financially, if you're struggling, you're housing insecure, you're food insecure, you're gonna have mental health issues. I mean, you're gonna be challenged. If you're housing insecure and you're a child and you're going from shelter to shelter, there is a correlation between that and the child's mental health outcomes. So having all these organizations is crucial to the Bronx, and maybe that what brings some people to the Bronx because of the services that are offered. HIV services, we have substance abuse services, we have food pantries throughout the borough, we have organizations, I mentioned mental health organizations. Sadly, there aren't enough out there when we come to mental health services. So, for example, there are waiting lists. So, if someone gets severely depressed or is dealing with a crisis in the family, they may have to wait a month or two to see a therapist, and that's a problem because it's a crisis at the moment. Versus, if they end up in the hospital for an emergency, they might be seen immediately, but then again, those appointments take much longer than need be. So I know that they're trying to address some of those issues, but I know that from my experience of sending students to the community for some types of mental health services, there is a waiting list for some organizations, and that changes daily. The Bronx has great domestic violence services, which is good. It's also bad. That means there's a high prevalence of intimate partner violence in the Bronx, and we have wonderful organizations here that help serve them. There's something called the Family Justice Center that's located, I believe, in Brooklyn as well. That has kind of an umbrella of organizations in one place, so the victim doesn't have to kind of jump around. They can get counseling, can get legal representation. There's a district attorney's office is located there. There's family therapy for their children. So that approach works more effectively when it comes to addressing some of the concerns. And so it's almost like an umbrella of services with different non-for-profit organizations in one place. And then you have the city agencies as well involved. So they're able to communicate more effectively, and hopefully people don't get lost in the mix. Um, I couldn't give you again the numbers of non-for-profits, but I believe if you do the research, you'll see we probably have the highest amount of non-for-profits. I was fortunate to be part of something called We Are the
That's
Bronx. No, actually, We Are the Bronx Fellowship. I had to look up there because I have my certificate. And We Are the Bronx Fellowship is an organization. It's actually run by the Jewish Community Council Relations, JCRC, Jewish Community Relations Council. We'll look at that up too. And they help coordinate this fellowship. And what it does is it brings together leaders of different organizations in the Bronx, newer folks that are interested in helping the community, how to better run the organization, how to elevate the organization, how to address the needs. So it's a 10-month fellowship where we learn the process, we learn about different organizations throughout the different boroughs, and specifically in the Bronx. And at the end, we actually put together a grant opportunity for the community. So we do a development, we learn how to raise money, fundraising, and then after the money's raised, then we put out an RFP for people to apply for this grant. So for example, when I was doing the fellowship, we were able to raise, I don't remember how much money, but it was like small mini grants that people can apply for. And I think one was related to the LGBT community and youth. Each borough had a different focus of what they wanted the money to go to, and people applied for those. So we learned how to develop that fundraising skill set, how to develop communication skill set, how to put in an application and review applications for people who were looking for funding for their not-for-profits in the Bronx. It was a very good experience, and again, there's these kind of opportunities that exist in this borough that I feel that are very helpful and useful into developing the new kind of folks that are in the borough that can help provide more organizations and services. The need is there, and sadly, there are a lot of challenges. So I think you see a lot more people getting into those areas of work and that profession and really trying to address those needs.
I do have a question.
Mm-hmm.
In your role, what kind of unique coping skills have you come across?
So coping skills you mean for students or for?
Yeah, students.
Sure.
Here.
So in my role here, I manage the health and wellness services, which includes a domestic violence program, includes any kind of health issues of some student might experience. We have a nurse on staff that can evaluate and provide them referral to healthcare organizations in the community. We have a grant that oversees students that are parents and also students that are expecting at the college. And the percentage is pretty high, I would say, in the community college, probably across CUNY, but we might be a little bit higher. And then we also have a wellness program where we try to do a lot of preventative work. So we do from HIV testing to offer physical classes like Zumba and yoga and salsa to keep people active. We bring a nutritionist to do health demos, to teach people how to eat healthy.
You guys do all that here?
We do all of that here, yeah. So we do all of that here with the work of non-for-profits. We can't do it ourselves, right? But we can bring them in to the campus, and they'll do food demos on a busy area in the campus and to teach people how to eat healthier. We're located in what I like to call food desert, and many other people refer to that as where there's a lot of unhealthy food options in this area, a lot of fast foods. So what we did is we partnered with an organization called La Canasta, which is part of the Mary Mitchell Community Center. And what they do is they bring in bags of healthy produce, some grains, fruits, that they get straight from the market, Hunts Point Market. They bring it to the campus once a week. People can pre-order their bags. They can use their EBT, their food stamp card. And it's a pretty good value you get, and you can use that and it stays fresh for a while. Again, to provide healthy options in a place that doesn't have all the healthiest choices.
Can you talk about the Not 62
Sure.
campaign?
So, in fact, yes, we have the 962 campaign, and we actually have an event tomorrow, which is called the Healthy Beverage Zone community launch. And so the Not 62 campaign is, so there are 62 counties in New York State, and there's an organization called the Robert Wood Johnson organization that does research on health outcomes and other issues in the different 62 counties in the Bronx. And as far as health outcomes, we fall in last place, 62. We're in 62nd place, and it's been like that for some years now. And so the hashtag Not 62 campaign is to really get people to use social media to promote health, to get people to share information about whether it be recipes, if they're working out and going to the gym, to encourage other folks to do the same, and to really promote health, to really get us out of the 62nd place, right? And I believe that'll change, and there's a lot of efforts to change that. But the reality is, it's a shift in culture, and that takes a lot of time, and it takes efforts from everyone. And you can't have one or two organizations or one or two people doing this. We need a lot of organizations addressing health issues. So what's great about this, tomorrow we're launching, it's called the Healthy Beverage Zone community launch. And this is about teaching people to drink less sugary sweetened beverages in their workplace, in their schools, in their agencies. So the idea is the less of those unhealthy beverage options you have, the more likely you are to drink more water, right? Or seltzer, or flavored seltzer, and decrease your sugar intake. What we did in the college, and also, and I have to give kudos to the student government, they helped support these water stations, refillable water stations around campus. Some campuses have it. You might have it at Brooklyn College. We didn't have it before. And what that did was it increased the amount of people drinking water. We provided them with kind of water refillable bottles. And it also, with those stations, it tells you how many water bottles are not being thrown to the dump every year. So
Like
from
how
the
many
landfills.
plastic bottles
Right.
did you say?
It tells you how many plastic bottles you save from the landfill, and that's a huge plus. So you're helping the environment, but also teaching people to drink water instead of sodas. I believe the numbers are staggering. The millions of dollars that people spend on sodas a year. I believe pounds, or about 16 pounds a year, you can gain from drinking soda alone. There's a lot of health issues related to it, and it's connected to a lot of health issues such as obesity and diabetes, etc. And so they're all interrelated. So that tomorrow we're launching this Healthy Beverage Zone, where we're asking organizations, agencies, education institutions to sign up and say they want to be a healthy beverage zone. So what they want to do is they want to provide more water options, less soda, and you also want to model that behavior. So it's about really having administration, faculty, staff, doctors, nurses, home health aides, etc., drink water instead of soda, because they're modeling what their patients or clients are seeing. And if you're doing that, if I'm a doctor and I'm smoking a cigarette, drinking a soda that's full of sugar, and I'm telling my patient that they have to be healthier, that's not a good message, right? If we change that message, we change the culture a bit, and that's what our hopes are. That again, we get out of that 62 place to maybe 61, and so on and so forth. There has been some progress made, but it takes time, and we've moved out of last place in certain areas, but we really need to focus on health. So with the work that we do in health and wellness, we're very connected with a lot of the organizations, the not-for-profits, and they do a lot of work with our students. They come on the campus, they do workshops on sexual health, preventions of STDs and HIV, talking about healthy relationships. We have organizations, like I mentioned before, teaching people how to eat healthier, how to shop healthier. We even have an organization that will take the students to a local grocery and teach them how to shop healthy on a budget. So we kind of just really look at what the needs are for our students, what they're experiencing, and then we talk to them about how to address those needs. finance is a big challenge, and so we've started looking into financial literacy and financial health. You know, how do we teach students to manage their finances